Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Chronic kidney disease. Introduction. Chronic kidney disease, also known as CKD, is the gradual loss of kidney function. When CKD reaches an advanced stage, dangerous levels of fluid, electrolytes, and wastes can build up in your body. When this happens, you will require treatment for the rest of your life. This program explains chronic kidney disease. It covers the anatomy of the kidneys and symptoms and causes of the condition. It also talks about treatment options. Anatomy of the kidneys. The kidneys are organs that are located in the middle to lower back on both sides of the spine. Each kidney weighs about 1 pound. The kidneys are each about the size of an adult fist. The left kidney is usually a little larger than the right one. The kidneys continuously filter our blood. The purpose of the kidneys is to filter wastes and excess fluid, make a hormone called erythropoietin that helps the body make red blood cells. The kidneys also regulate bone metabolism, blood pressure, acid-base and electrolyte balance. Your kidneys filter wastes and fluids from your blood. The waste leaves your body through your urine. The urine that is made in the kidneys flows through tubes called ureters to be stored in the bladder. When the bladder is full, a person feels the urge to urinate. Urine is emptied through the urethra. Symptoms. Symptoms of kidney failure usually don't appear in its early stages. Some people don't have symptoms for 30 years or longer. Healthcare providers call this the silent phase. When you start to notice symptoms, you may urinate less often, have fluid buildup and swelling, lose your appetite, lose weight without intending to, feel tired. Other symptoms of CKD include feeling nauseous or sick to your stomach, headaches, trouble thinking, trouble sleeping. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Chronic kidney disease develops gradually over many years. The condition causes permanent and irreversible loss of kidney function. Damage to the kidneys can lead to CKD. Causes of this damage include high blood pressure, high blood sugar and diabetes, drug abuse, inherited genetic diseases such as polycystic kidney disease, lupus. Common causes of CKD also include kidney infections or blockages, using certain medications for a long period of time. Diagnosis. To diagnose chronic kidney disease, your healthcare provider will perform a physical exam. He or she will ask you questions about your personal and family medical history. Blood and urine tests will also be done. This can help your healthcare provider evaluate your kidney function. A blood chemistry screen can show if you have normal levels of sodium, potassium, and calcium. You may also have an ultrasound. This imaging test lets your healthcare provider look at the kidneys. Other imaging tests that may be done include CT scan, MRI, X-rays. A kidney biopsy may be done if your healthcare provider thinks your kidney may be inflamed. A kidney biopsy is usually done using a long, thin needle put through the back into the kidney. A tissue sample is taken and then sent to a lab for examination. Your healthcare provider may be able to diagnose CKD if tests show that you have blood in your urine, a certain medical condition such as polycystic kidney disease, excess protein in your urine, kidneys that are not structurally normal. Treatment. Treatment for chronic kidney disease focuses on slowing the progression of kidney damage, usually by controlling the underlying cause. CKD is divided into 5 stages. In the early stages, you may have few signs or symptoms. CKD may not cause symptoms until your kidney function is dangerously low. In stage 1, the kidneys may function normally, but tests show other evidence of kidney disease. Stage 2 is mildly reduced kidney function, along with other evidence of kidney disease. People in stages 1 and 2 may not be aware that they are at risk because they may not feel ill. Treatment for patients with stage 1 and 2 CKD includes blood pressure control, treating diseases such as diabetes. Treatment for patients with stage 1 and 2 CKD also includes close monitoring by a healthcare provider and occasional testing. Lifestyle changes, slowing the progress of the disease with diet and medication. To reduce the risk of CKD progressing, don't smoke. Don't drink alcohol. Follow all instructions on over-the-counter medications. Maintain a healthy weight. Manage your medical conditions. If you're a smoker, talk to your healthcare provider about ways to quit smoking. Support groups, counseling, and medications can help you stop. If you're at a healthy weight, work to maintain it by being physically active most days of the week. If you need to lose weight, talk to your healthcare provider about healthy weight loss. If you have diseases or conditions that increase your risk of kidney failure, work with your healthcare provider to control them. Ask about tests to look for signs of kidney damage. Stage 3 CKD is moderately reduced kidney function. Most stage 3 symptoms can be managed through monitoring by a healthcare provider and regular testing. Medications can help prevent further kidney damage and control symptoms. The goal of treatment for stage 3 is to prevent further kidney disease and reduce other risks associated with the condition, such as heart attacks, narrowing of the arteries, strokes. Stage 4 CKD is severely reduced kidney function. During stage 4, healthcare providers treat complications and help the person prepare for treatment. During stage 4, you should learn about different types of dialysis, accesses used to perform dialysis, other treatment options. In some cases, you or a caregiver can be trained to do dialysis at home. Dialysis is the artificial filtering of wastes and fluids from your blood. There are 2 main types of dialysis, hemodialysis and peritoneal dialysis. Both types filter your blood. They remove harmful wastes, extra salt, and water. Hemodialysis uses a machine called a dialyzer or artificial kidney. For this treatment, surgery is needed. An access or entrance is usually made in your arm so that your blood flow can be directed into the dialyzer. Blood is cleaned in the dialyzer. The blood is then infused back into your body. You can be taught to do hemodialysis at home, or you may go to a special clinic for treatments several times a week. Peritoneal dialysis uses the lining of your abdomen, called the peritoneal membrane, to filter your blood. It can be done at home and is a more comfortable and natural way to do dialysis. Surgery is needed to insert a soft plastic tube called a catheter in your abdomen. During peritoneal dialysis, a cleansing fluid flows into your body through this catheter. When the filtering process is done, the fluid leaves your body through the catheter. A person diagnosed with stage 5 CKD will require frequent monitoring and treatment for complications. Stage 5 CKD can cause death unless you receive dialysis or a kidney transplant. In addition to medical treatment, you may choose to receive palliative care. The goal of palliative care is to help people with a serious illness feel better. It prevents or treats symptoms and side effects of the disease and of its treatments. Palliative care can be given at the same time as treatments meant to cure or treat the disease. You may get palliative care when the illness is diagnosed and throughout your treatment. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Chronic kidney disease is the gradual loss of kidney function. It is also known as CKD. When CKD reaches an advanced stage, dangerous levels of fluid, electrolytes, and wastes can build up in your body. When this happens, you will require treatment for the rest of your life. The purpose of the kidneys is to filter wastes and excess fluid, make a hormone called erythropoietin that helps the body make red blood cells. The kidneys also regulate bone metabolism, blood pressure, acid-base, and electrolyte balance. Symptoms of kidney failure usually don't appear in its early stages. Some people don't have symptoms for 30 years or longer. Healthcare providers call this the silent phase. When you start to notice symptoms, you may urinate less often, have fluid buildup and swelling, lose your appetite, lose weight without intending to, feel tired. CKD is caused by damage to the kidneys. The most common causes of this damage are high blood pressure, high blood sugar, and diabetes. Treatment for chronic kidney disease focuses on slowing the progression of the kidney damage, usually by controlling the underlying cause. In the later stages, dialysis or a kidney transplant may be needed. Thank you for using Explain.